Hello and welcome to our COVID-19 update program at this hour. I am Ladi Akiriduluale. Here are the highlights. World celebrates the International Nurses Day as nurses in Lagos distribute face masks to residents to curb further spread of COVID-19. Federal government warns Nigerians to desist from the use of recycled masks across the country. And U.S. immunologist Anthony Fauci warns against the reopening of states in the United States. The World Health Organization has started using the phrase physical distancing instead of social distancing as a way to prevent the spread of the novel coronavirus from people to people, a move widely welcomed by experts as a step in the, quote, right direction. At a daily news briefing on March the 20th, officials of the global health body said while maintaining a physical distance was absolutely essential amidst the global pandemic, it does not mean that socially we have to disconnect from our loved ones or from our families. Since coronavirus is spread mainly through respiratory droplets, especially when people cough or sneeze, maintaining a safe distance is recommended to decrease transmission. Many say the challenge is that the phrase social distancing confuses people. They argue that what we really want is physical distancing from people and not social distancing. So the question is, how can we maintain social activities during the COVID-19 era? The question we'll be looking at tonight on the program. But first, let's have a look at some of today's stories. And we start off with a group of health workers, the nurses. Today is International Nurses Day, an event celebrated on the anniversary of Florence Nightingale's birth. The theme for this year is A Voice to Lead, Nursing the World to Health. Nurses are among over 113 health workers that have been quarantined after contracting COVID-19 in Nigeria. In Lagos, the number of nurses infected has hit 20. To celebrate today, the Lagos State Council of the National Association of Nigerian Nurses and Midwives has taken the Enlightenment train to members of the public. The nurses put their words into action by sharing face masks to Lagosians in Ikeja area, advising them to keep practicing the set-out measures to break the transmission trend of the virus. The vice chairman of the association, Mary Lateef Yusuf, says it has become imperative that they join in sensitizing the public because of the burden of caring for the increasing number of COVID-19 patients.
Well, it is important to me as a nurse to create awareness about the pandemic because you and I know that prevention is better than cure. If we can create awareness among our people to observe all the rules of prevention of COVID, we will reduce the workload in the hospital environment. It will cost the government less, and the nurses too will have lighter workload. And that is why we are saying we need to remember to keep the social distancing. We need to move away from one another. People are still mingling together, and people are not observing the appropriate hand wash and use of sanitizer. We are telling them to do this so that they are not infected. They should use their face mask. We are even distributing face masks to them. For those that we find are not using face masks, and we tell them the importance so that they will not be infected. Majority are breadwinners. When they become infected, who takes care of the home? Who takes care of the family?
Meanwhile, Nigerians have been warned to be mindful of already used masks being recycled across the country. Speaking today during the presidential briefing in Abuja, the Secretary to the Government of the Federation, Mr. Boss Mustafa, explains that such masks are hazardous medical waste, which should only be disposed of by burning. He warns that such personal gear should not be shared to avoid the spread of COVID-19.
The Presidential Task Force has become aware of the ongoing practice of sharing masks and picking of masks from recycling or recycling from dump sites. This places a lot of responsibilities on all of us to be self-educated and to educate others. The following points I emphasize. With the exception of fabric masks, every disposable mask used is a hazardous medical waste and should be disposed of properly, preferably by burning. It is very risky to share masks as the virus is capable of remaining on surfaces for several hours and you could get infected through the processes of sharing masks. 3, the unhealthy practice of picking up disposed masks for whatever purpose is harmful to both the individual picking it and whoever procures it later. Particularly, it will be helpful for high-risk people such as elderly and those with comorbidities to wear masks or face covering and avoid crowded places.
Pupils from the Federal Capital Territory have emerged the first set to benefit from the lockdown school feeding intervention program. The Minister of Humanitarian Affairs, Disaster Management and Social Development, Sadia Umar Farouk, said this while speaking on arrangements already made to continue the school feeding program even out of school.
We had consultations with the state governments. We have a structure on ground that provides this school feeding intervention to these children. We have the aggregators, we have the cooks within the locality, and we also have the school management. Now we're talking about localities where these children come from. And I know that in each locality where we have these schools, most of these school children, they know their homes. They know where they come from. So we are targeting these homes where these school children come from. We're giving this voucher to these households that are being identified as where the children, the school pupils are. And they come to the distribution center to pick this dry food ration. We don't need to have their phone numbers. It's a small community where these schools are, and it's like everybody knows everyone in that community. They know the children that attend this public school, and this is the structure we're using. We're using CSOs, we're using NGOs, we're using security operators, the DSS, the ICPC, the EFCC, and all the security structures on ground to make sure that these things are being properly monitored and evaluated. We have just flagged up the inspection of these stores and facilities where this food have been taken to, and by Thursday, God's willing, we are going to flag off the FCT food distribution to these households where these children come from.
7 COVID-19 patients have been discharged from the Jigawa State Isolation Center where they recovered after receiving treatment. The governor, Badaru Abubakar, confirmed this to newsmen in Dutse, the state capital. According to him, the number of confirmed cases in the state is 118, with 2 deaths, with 53% of the total cases being Almajere repatriated from Kano. The governor projects that the best case possible may reach 800 within the state, while the worst case could be up to 20,000.
You will agree with me that COVID-19 infection is now with us in Jigawa State, as the disease has spread to 8 local governments out of the 27 local government areas of the state. The state has total number of 118 confirmed cases, with 2 facilities so far accommodating them. So far, 7 patients have been cured and discharged from the isolation facilities. Out of the current 118 patients, 63 are Almajiris deported from Kano, representing 53% of the total patient load in the state.
The governor of Jigawa State, Badaru Abubakar, joins us now from its capital, Dutse. Good evening, Your Excellency, and thank you for your time. Are you not panicked, sort of, at the number of cases that you have, half of which are from Kano, which is your neighboring state, and we all know what is going on in Kano even at the moment?
Well, you see, the advantage we have, the Almajiris, we receive them and we keep them in isolation since the time we receive them. So they have not mixed with the community. So there is not much of contact tracing. It is easy and a lot easier for us to handle the Almajiris that are there. But for the remaining cases, you know, they come out of intensive contact tracing. So what we receive from the Almajiris is limited to already. And we have not mixed them with anybody. So those that tested positive among them are isolated and put in the isolation center, and the remaining ones are being sent home. So I don't think there is anything to panic about. I know we are never in Kano, but our borders are tight, and people are beginning to be aware of this problem, and they are becoming apprehensive of what is going on. And we are getting calls every day on people that moves in or out and back, and we continue to trace them. So I don't believe there is any reason as it is now to be alarmed on this situation.
There are two things that are going on simultaneously. There's the Northern Governor's agreement to move this Almajiri back to their states of origin. But at the same time, there is supposed to be an interstate lockdown, a ban on interstate movement. But since these movements are being done by the state governments in cooperation with each other, it's difficult to know which one is legal and which one is illegal, because some of those Almajiri have found their way even down south, outside of the northern region. With benefit of hindsight now, do you think this was a decision that ought to have waited, especially because, take Jigawa State, for example. You have 118 cases there now. That's a pretty high number once you go outside of Lagos, Abuja, and Kano.
Yeah, sure. Well, in the first instance, the governments that send the Almajiris always send them with escort and letters to the states, and they call us before they send the Almajiris. So we know those that are coming officially and those that are not coming officially are being blocked. That is one. Two, on the timing, I believe the timing is wrong now to move the Almajiris because this movement started at the time when we had the epidemic around the states. And I also believe that the children are young and you cannot control them. The moment you bring them from different parts of their own schools and mix them all together, before you sort them, they will mix together. No matter how hard you try, they will mix with each other and play with each other. So I still believe the timing is wrong. That is why in Jigawa we decided to keep all the Almajiris in their own respective schools and feed them until the issue of corona subsidized or we are able to do massive testing. Then we'll decide whether to take them back to their states or not. But you can see in some of the Sangaya, some of the schools, there are only 10, 15, 20. But when you put them together in trying to sort them out and send them back to their state, they mix together. Maybe one Sangaya have the situation and the rest of the Sangayas don't. And then when you mix them, it becomes a problem. So I still believe this could have waited until after this pandemic is under control, then we move them around. It is a very good it is a very good decision by the Governors Forum to move the Almajires back home and have the parents take care of them and put them in both Islamic school and also put them in a normal school so that they will also have the Western education and the Quranic education simultaneously. And this is what we are doing with the ones that has been sent to us. We are sending back to their parents. We have their numbers, we have their names, their village heads are aware, and when schools open, we are going to put them back in school and also create an environment for them where they will do the Islamic, the Quranic learning in their own homes or around Islamic schools that we'll arrange and have in all the locations where we have a lot of them.
See, we have just over a minute, and I want you to address this in that time. There are those who have said that there seems to be a lack of coordination of efforts between the federal and state governments, and that that lack of coordination, that seeming lack of coordination, is affecting the response and the effectiveness of the attack on COVID-19. While some states are locking down, others are opening up, and many are not obeying federal guidelines. What do you make of this?
Well, I agree we have to coordinate this thing much better, but in a situation where you have crisis, management of crisis is not easy, I believe. Coordination could have been better, but for the rest, we have done well. I know now the governors are meeting, and they managed to find a way to synchronize our own activities with that of the federal government. As you are aware, we sent a letter to the president. The Governors Forum sent a letter to the president about a week or so with our own thoughts, and we are in talk with the federal government and the task force initiated by the federal government to make sure that the governors in the states and the federal government are on the same page on this. But crisis is always like this, and the management of crisis is always not easy, more especially where there are panic around all over.
Your Excellency, the Governor of Jigawa State, Mohammed Badaru Abubakar, thank you so much for your time, and we wish you the very best as you seek to tackle this pandemic in your state.
Thank you very much, and thank you for having me.
We'll take a break at this point. When we return, we'll bring you up to date with the figures surrounding this pandemic across the country. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. 242 new COVID-19 cases were reported in Nigeria from 14 states in the last 24 hours, and they have taken the total number of confirmed cases in the country to 4,641. With 902 patients discharged and 152 deaths recorded, the total number of active cases stands at 3,587. 2,194 of the total confirmed cases in Nigeria are in the southwest, and Lagos has the highest with 1,933. The northwest follows with a total of 1,303 cases. 666 of those cases are in Kano. The northeast is next with a total of 535 cases. Borno has 186 of that, followed by the north central region with 445 cases. 359 of the cases are recorded in the Federal Capital Territory. Edo State's 97 COVID-19 confirmed cases is more than half of all the cases in the South-South, which stands at 141. The Southeast has a total of 23 cases, with Enugu State having 10 of those cases. Okay, let's go to the North Central region, one of the regions that we just spoke about. And from there, our correspondent, Empress Simon, sent in this report earlier from Minna, the Niger State capital.
Away from Niger State to Benue State, where the government has confirmed 3 additional cases of COVID-19. bringing the total cases in the state to 4. 2 of the cases confirmed by the state government were a woman and a baby, while one other person was from Kano State. The state government has also quarantined 15 persons. One person was said to have absconded from Lagos State, having tested positive of the virus, but decided to return to Benue State. However, he was intercepted by the state government along the way. But the vehicle he boarded was carrying 14 other persons, and the 15 of them have been quarantined and their samples have been taken to NCDC for testing. Don't forget again that Benue State received 12 Almajiri children and they have been isolated for the past 6 days. Their samples have also been taken to NCDC for testing, but the results are still pending. That's the update from Niger State and Benue State in north-central Nigeria. Emperor Simon.
Emperor Simon, thank you for that update from Minna in Niger State. Joining me in the studio at this point is a consultant public health physician, regular here, Dr. Alera Roberts. Thank you so much once again for coming in.
And thank you for having me.
The key subject of discussion today is the issue of social distancing becoming physical distancing. Now, a lot of people are confused because when we all started this, we were told social distancing. But then we were told that, yes, that meant staying some distance away from other people, but it didn't mean disconnecting from family members and so on. Then when it became physical distancing, some said it was a bit clearer, some said it wasn't. One thing everybody seems to agree on is that we are not finding it easy to do.
No, we're not. As a people, I mean, let's face it, under normal circumstances, you and I would not be sitting this far apart. But do that, just stretch out your, there you go. That is what we call physical distancing. So we're in the same room, we are connecting, we're talking, we're having a chat, but we're physically distant from each other because the science has shown us the distance that the droplets can spread when you're talking, coughing, sneezing, different things that one is doing. But what has also come to light is the fact that as families and friends, we do need to be connected because the human being is by nature a very social person. Well, we live in large social groups, and that has been the essence of that's what defines us as a species on the earth. So, you know, even if we have to be physically distant, I mean, there's nothing stopping you from calling your mom, and now thanks to all these new technologies, not Skype, I must confess, you know, WebEx and Zoom and FaceTime, we can actually keep in touch with members of the family. And many of us who have family members in different parts of the world actually do so. Not quite the same thing, but certainly a lot better than not connecting at all. And that way, we are also able to pass on the right information. So I think it's purely semantics, perhaps, but I think it's the right thing for WHO to come out and say, actually, what we're talking about here is physical distancing. And Ladi, you will recall that when the lockdown was lifted, we saw crowds of people. That's right. I mean, we do need that physical distance in between if we're to halt the spread of this disease.
Which brings me to what you started off with, that we are by nature like that. And so you find that even when we start by observing it, certain situations then arise where you find that people tend to forget and they go back into this. So it's going to take some time.
It will take some time.
And there are those who are pointing out that it's going to be with us. This is not something that is hanging around only for a couple of weeks and that along with the lockdown, it will go away.
Correct.
Which means it will affect interactions.
Absolutely. And don't forget that we've been having this discussion on and off, that how do we live not in a post-COVID Nigeria, but in a post-lockdown Nigeria. There's a big difference between, because we do accept that the COVID is going to be with us for a while. And we've talked about the game changers, the ability to do much for rapid testing. We've talked about the possibility of a vaccine. And these are things that will change the outlook as time goes on. But it is still a process of time. So, you know, there are some tough habits where, look at me, I'm still clasping my hands to stop me from rubbing my eyes and tickling my nose. You know, there are some habits that we're just going to have to form. And I think the physical distancing and how it translates, particularly those of us in the southwest of Nigeria who are extremely social, and you know what I'm talking about. There are things that we're going to have to live with in order to slow down the spread of this virus.
Correct me if this is wrong. I mean, that's why I'm asking. There are those who point out that that connection in terms of social interaction between people also helps them health-wise, particularly those who, it turns out, are the most vulnerable.
Absolutely.
With this. So the staying away from them tends to give the wrong idea.
Absolutely. And considering that I have an almost 90-year-old father sitting in my house who cannot go to his favorite club on a certain day of the week, and they're all getting really agitated. For the older folk, it is particularly hard because they've really known no other means of communal living than actually being in touch with people and getting a hug from the grandchildren and tapping the shoulder and sitting side by side with your girlfriend of several decades to have a good natter. So that is being particularly hard on the old folk. And as they grow older and their immediate society shrinks by virtue of death and whatnot, this is particularly hard on them. And it's something we're really looking for solutions to it. So how do we continue with the inclusion without putting them at greater risk? Definitely one of the things we're going to be looking at is this growing herd immunity, which we cannot prove until we have far more widespread testing, but which we know is going to happen. So again, we're talking about a process of time where, you know, if we can keep people exposed to very small amounts of the virus, their body can kick in with immune responses so that eventually we can get back to being together, but certainly not in the immediate future.
Staying with this social or physical distancing thing. Now, if you say, I mean, you've got to stay physically away, there are some people for whom the economics make it impossible.
Absolutely.
In our own environment, you have people who live 10 in 2 rooms and so on. And this situation hasn't changed that living arrangement. So they are more or less compelled to continue. How best do you think they can tackle this, given the fact that they can't stretch their hands in those 2 rooms and nobody will touch?
Absolutely. And this is where the hygiene and sanitation now comes in. We need to have improved water supply. We need to have improved sanitation and hygienic practices. This thing we say hand washing with soap and running water. However you want to do, I've seen some very ingenious and innovative solutions to providing this. We have to keep reminding people, wash your hands constantly under running water with soap for at least 20 seconds. It's so important because that is the only way the virus can actually enter the human body. It enters through the mucous membranes, which are in the mouth, the nose, the eyes.
Right.
You know, so the virus being on my hands, as it is, will not infect me. Where it is going to infect me is when I now take my hand and start rubbing my eyes or picking my nose or taking bits of food out of my teeth without washing my hands. Now, I will not remember to not touch, but I must remember to constantly wash hands or use a sanitizer in between. So, and then wiping the horizontal surfaces constantly with a mild solution of hypochlorite bleach, household bleach. So constant wiping means that even as I'm breathing and talking and maybe even dropping the virus, it's constantly being wiped away so that we lower the amount of viral load in the community. I know it's not going to be to 0, but by so much that transmission becomes all the more difficult.
I'll put Dr. Roberts on pause, and I think we can go now to somewhere in Lagos where our correspondent Olu Phillips is standing by. Olu, good evening. Where are you this evening?
Good evening, Laddie. Good to hear from you again. We are somewhere around the entrance into the Third Mainland Bridge, somewhere at the tip of the Third Mainland Bridge, where we want to bring a report tonight.
Well, I see from behind you there that you're not surrounded by people like you were a couple of days or weeks ago. So, and since one of the things we are talking about today is the issue of social distancing, From your reporting, would you say that people have come to accept that this social distancing is here to stay, and are they complying, do you think?
Ladi, the COVID-19 coronavirus is called a novel coronavirus pandemic. What that means is that everything about this disease, as it were, virus, is novel. And it also means that tackling it and bringing solutions to getting it out of our society will be novel, meaning that some of the things we'll be practicing, some of the endeavors, some of the actions we take will be new to us, and they will remain a constant for a while to come. Two case in point, for instance. The Lagos state government has announced that buses should carry 60% of its capacity, meaning that a commercial bus that, for instance, takes 4 people on each roll has reduced to about 3, 2 in some cases for commercial tricycles and all of that. The other case will be the banking system. Let me tackle that of the commercial buses, for instance. You're asking if people are embracing the new normal, which is social distancing. I will tell you, they want to embrace this social distancing thing, but they are paying a huge price for it. And that's because the buses have insisted on, the bus drivers have insisted that they pay the differential that is arising from the shortage, as it were, from the number of passengers that they have. Now, so this is a place of conversation between, for instance, the Nigerian Union of Road Transport Workers, or should be, between that and the Lagos state government. People should not pay for so much for this because people are already going through hardship. Then look at the banking system. When I go around the city and ask people and visuals, and all we see is, for instance, banks have now put out trampolines and put out sheds, put out plastic chairs where people now sit down. That is a very sad, nostalgic remembrance of what used to happen in the days of my father, where you had to go to the bank and take a tally number. Today, that has returned to our banking system, and you ask yourself, is this about the efficiency of the bank, or are there more people wanting to use the banking system? What has happened to the online banking system, the non-physical banking system? Why do we have a lot of people thronging the banking hall and have to sit hours and hours and hours outside? If you say because you don't want people to be crowded inside, then the next question to ask will be, how many minutes does it take in an effective banking system to attend to a customer, Ladi?
Indeed, Olu, these are some of the difficulties, and some of the visuals that we're seeing there already indicate this. Thank you very much, Olu, once again, for this reporting. We will, as usual, check in with you later on as the program progresses during this week. Our correspondent, Olu Philip, reporting from here in Lagos. Now, Dr. Dr. Roberts, I got that mixed up. As a final takeaway, for those struggling with this, what would you tell them?
That is becoming increasingly more difficult because we're repeating the same things over and over and over again. It's still the hand washing. It's still the use of an alcohol sanitizer if you can't get to a hand washing facility. It's still now I'll call it physical distancing, maintaining 6 feet between you and the next person. It's still avoiding the crowded spaces. It is still about sanitizing the horizontal surfaces and high-touch areas constantly, regularly, same message over and over again. It is still about avoiding crowds. And I have to make a comment about the banking situation. I do think it is actually quite deplorable. And I thought it quite sad that one of the top banks that we noticed on the television screen that had the huge crowd underneath, and they have not been able to perfect the internet and online banking and insisting that all their customers use it, because that is just making nonsense of everything we're trying to say. If we're talking about the buses, considering that for 7 weeks, they were not able to make any income, and to now restrict them to a 60% capacity when they're trying to make up the differential. When they're trying to make up the differential, who is supposed to pay for that differential? So some of these rules and regulations really boils down to us taking collective responsibility for our health by keeping to these simple rules, so that the faster we stop the transmission, the sooner we can get back to our new normal.
Dr. Roberts, thank you so much for being here this evening. Thank you so much for your time.
Thank you for having me.
Let's go straight to a COVID-19 survivor, a fresh one at that. We're being joined now by former presidential spokesperson, Dr. Doyin Okupe. Good evening, Dr. Okupe.
Good evening, Ladi.
What was the experience like?
Well, it's something I do not wish for my enemy. And it is better for our people to understand that this COVID-19 is real. You don't need to go through what we have gone through before you realize that. And that is why all the mantra about the social distancing, the hygienic washing of the hands, everything and anything that you can do to prevent yourself from getting infected, you should do it. You should do it. In God's name, you should do it. It's a matter of life and death. I'm lucky. My wife was lucky. We were there for 20 days. But, it is living day by day. You don't know what's going to happen the next day, whether you're going to get a fever, you're going to get a cough, or a result is going to come to say you are positive. And it is just, it is just something not desirable.
At the isolation center, we've heard so much about the level of comfort or otherwise of some of the isolation centers. What was your own experience like in terms of facilities, management, and so on? What was it like?
I was isolated at the Shagamu Center, and I think it's a purpose-built place. There's a general ward, and then there's a private wing to it. But, I think, it was something that can pass for something good anywhere in the world. It was really, really very comfortable. And, the doctors and the nurses totally subjected themselves to all sorts of things, Sometimes when when they have temporary shortage of PPE, you will see the head of the team come in, with, something like a makeshift. And, then, as a doctor, a consultant, has to now work as a nurse and as a cleaner, carrying food, doing this. The health workers, the role they're playing is underestimated. And it is really, really incredible. But for them, many of us will not survive.
Well, we are celebrating some of those health workers today, particularly the nurses, and I'm happy that you did mention the nurses there. Going forward, what would you ask those who are managing this crisis? Very briefly, what would you ask them to consider? Since you've been in and you're now out, thankfully, what would you ask them? What is the one single thing you would ask them to consider as being most important at this point?
Well, they must comply with instructions. They must, they must subject themselves to treatment when things are not going well. Trust in the doctors and those who are managing you. And I don't know. For me, I was extreme. My wife and I, we were extremely, extremely prayerful because at a point in time we were both negative. Then another result came, and I was positive. And that is so depressing. But I give glory to Almighty God because I called upon Him and He answered me. I am so grateful to God.
Dr. Okupe, thank you so much for joining us tonight, and congratulations on your recovery. This perhaps gives others the good news that it is possible to recover. Thank you so much for your time. Dr. Okupe, of course, joined us from Ikperu in Ogun State. We'll take a break now, and when we come back, we'll go outside our shows to bring you what's going on with regards to COVID-19. Please stay with us. Staying with the topic of social distancing, as the economic impact of the COVID-19 pandemic bites harder, more and more families troop to any place where food parcels are a possibility, regardless of whether or not they are obeying social distancing. While many watchers worry about this distancing or its absence at such places, the people on the queues say food still needs to be put on the table. Channels Television visited a number of such places and spent a day with former Nigerian international goalkeeper turned pastor Ida Peterside, who uses his church to distribute dearly needed food and household items to those in need in Johannesburg, South Africa.
Under normal times, this auditorium would have held big and small church gatherings. Things have changed courtesy of COVID-19. While church services have shifted online, this church decided to turn the auditorium to a collection center for those in need.
When the government was trying to help the poor of the poor in South Africa, they did not include the foreigners. And I'm a foreigner. I understand how it is to survive in a country like this without help. Most of our boys and girls are on the street plaiting hair, looking for food, and no one is helping them. So I decided, I said, okay, let the foreigners come.
Outside the church, a winding queue of over 600 people awaited something to take home.
Physical distancing gets quite difficult in settings like this. It's all about survival, the people say, as a place on a queue like this is one golden opportunity to keep hunger at bay, at least for a few days for many.
So it was in through one door and out through another, many of them much happier.
Thank you, Jesus.
As we left, the queue had even begun snaking up the major road. We also visited the Deep Sloot township north of Johannesburg, and the picture was the same. Thousands more turned out to collect food parcels during a program that was meant for just young people and single mothers. The picture leaves government quite worried about the health implications, as one of such queues recorded a near 3-kilometer stretch of people queuing up for hours for food. Lockdown remains on level 4, so many more business sectors are still not allowed to open. But for those open, there's hope that less people will be on queues like this. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
Top United States infectious diseases expert Dr. Anthony Fauci has warned Congress that a premature opening of the nation's economy could lead to additional outbreaks of the deadly coronavirus. Testing virtually before the Senate, Fauci, who is also the director of the National Institute of Allergy and Infectious Diseases, warned that states should follow health experts' recommendations to wait for signs, including a declining number of new infections, before reopening. The U.S. President Donald Trump has been encouraging states to end weeks-long shuttering of major components of their economies. Let's go to Washington, D.C. and speak to our correspondent, Maria Bird, who joins us now via Skype. Good evening, Maria. Thank you for your time at this period. Let me begin with what we just talked about, but leading it into something else, which is Dr. Fauci's testimony before the Senate saying, look, it may be premature to reopen.
Yes, I mean, Dr. Fauci, that was what was expected. Many people were speculating what he might discuss before Senate today. And many people felt that he would definitely be saying that if we reopen too soon, especially states that are hot spots and hot pockets, you could see outbreaks. And so, June is going to be a real test because many states are beginning to reopen beginning this month in May. And so if June we start seeing outbreaks again, it will be because some of the reopening policies and guidelines were not strictly followed, and some states might have reopened a bit too soon.
Some of the people that we rarely talk about the impact of all of this on are the children. What can you tell us about that at this time?
So there is a disease called the Kawasaki disease that they are now, it's an inflammatory disease, they are now tying to potentially COVID-19. They're saying children that contract COVID-19 could potentially end up with this specific disease. In Washington now, there have been a couple of cases of children that are in Children's National Hospital who are fighting this disease. And so they're saying that, as we've always been talking about, children are kind of more on the safe side. And obviously the mortality rate is not extremely high for children. And it's still, they have far lower risk than those with underlying conditions, but they are not free and clear of being impacted health-wise by COVID-19. So this does impact the education system. So as they think about reopening schools, this will have a dramatic impact on how they begin and the policy they put in place as they look to reopen schools.
Thank you very much, Maria Bird, for your reporting out of Washington, D.C., and do stay safe out there.
Thank you.
And just before we go, we've got one final story, good one, Spain's oldest woman, Maria Brania, has recovered from COVID-19, believe it or not, at the age of 113. She had celebrated her birthday in March, just before the pandemic took hold. Her family must have thought they would never see her again when she went down with coronavirus. But after weeks in isolation, she recovered, having suffered only mild symptoms. Thank you for being with us. My name is Ladi Akere Doluale. That's our COVID-19 update tonight. Good night.